That's that. Now turn the page. The next page is all your select alls for all your precautions, right? So precautions are, where are we? Generating solutions. I just left prioritizing hypothesis. That's what this page was. Which shock is it? Prioritize the hypothesis. Was it cardiac, neuro, or respiratory? Which one was it? This page with all these damn precautions is now fixing. Start generating some solutions. Preventing further damage. Y'all feeling me on this? All of this is here, number 8, part of the test plan. Physiologic adaptation, and your precautions are under safety. Okay? So if you look, these are easy. You know them well, but I'm going to point out some things you may not know. Do you see how it says bleeding precautions? I put the word thrombocytopenia there. What does that mean? Low platelets. So everybody with thrombocytopenia, low platelets, alcoholics, everything else, need to have these precautions. So if you look at these precautions, I put the no's together. Y'all see it? No razors, no flip-flops, no flossing, no contact sports, no enemas, suppositories, and sex, anally. No aspirin, no Nsaids. Now, what I did differently on this page that qualifies as one of my updates I had to make, back in the day when Ashley was in class, the test still had a lot of brand names on them. We started getting some generics, but she got a lot of brands. So we have brand names here on your old, oh my God. These are all your generic names for all of your Nsaids, the ones by prescription. For example, you had 2 nurses stood right here in this spot, told you how they passed their test, and they both had Celecoxib on their test. If I were you, I would highlight that. Celecoxib under Nsaids, no Nsaids. Do you see it? Okay. All right, so that's another one that used to be on the paper. If you look at an old, oh my God, it would have just said Celebrex, because that's what we called it, okay? Now your patient does not know how to say that. So once again, to tell yourself all I gotta do is learn all generics is fucking crazy, because you're gonna kill somebody out here. Your patient gonna come in and tell you they took Celebrex, and you sitting there not knowing that's an Nsaid may not understand the relationship it plays in her bleeding out. Okay, you say, you know, you got all these meds, you're looking at the damn Epic, you see all these meds, what do they mean? And this one is not easy, so I put that in there for you, and you just gotta kind of remember. Now, what about that ketorolac? What's another name for that? Toradol. Yes, Toradol. Very nice. You care about that. You really care. Ketorolac is Toradol. Okay. All right. So there you go. Now, notice it says no alcohol, no vitamin E, and then it talks about no G herbs. Do you see the G herbs? Remember that you, my dear, you are an alcoholic, and therefore you need to remember all your G's. The way you alcoholics remember your G's. You like white liquor. You alcoholics still with me? Okay. Ginger, ginseng, ginkgo, biloba. That's 3 of the 5. Everything else you can figure out. Garlic and green tea. Do you see how we did that, alcoholics? Okay, mama. So you got it. Boom. Go back to your gin. You'll be fine. Okay? Now, so that's your 5 G's. The one you forget and are very naughty about on your test, like the shit in this little list, is that oozing at the IV site. They're going to have that on there, I promise you. And just in case you think this is textbook bullshit, let me help you with this. My papa had mesothelioma, and it's a long time ago, he's gone to heaven, but let's look at that, mesothelioma. You guys may not know what this is, and it does show up on the test. Who knows? Oh, go ahead, honey. Yes, this is lung cancer, because it said OMA. from asbestos, meaning it's the type of lung cancer you get and you never smoked a cigarette, right? Okay, so he died from this. You know, they got the commercials on how they pay you and all this shit. So he got the mesothelioma. He's getting chemo. Before he even got the chemo, to show you informed consent was wonderful. I love UH. I love UH and the clinic. But at this point, my papa was at UH with the UH doctor, University Hospital doctor. So Dr. Halmos looked him in the eye. It was sitting right on his level. And he said, we're going to give you some options and we're going to do whatever you tell me to do. You have, with nothing, you do nothing at all, you have about 6 months to live. If you do the chemo and the radiation, we can probably pull that out to 18 months to 2 years. My papa, my youngest daughter, is his only grandchild. She was graduating from high school. He wanted to see that. So he looked Dr. Halmos in the eyes and he said, I want to live. Let's go. What do I need to do? He said, okay, let's do it. He did the chemo, he did the radiation, and he lived 5 more years and moved her into Ohio State. So you can be God. I love it. He just knocked that shit out the box and lived 5 more years, okay? Now, so during that time, I'm like old school. I don't believe in leaving old people to do their own thing. Whether it's my dad or my papa or my mama, I'm gonna be with you the whole time. So I'm with him at his chemo. I don't tell people I'm a nurse, neither should you. You go to these different appointments, shut your mouth. Never ever tell. Because number one, they're gonna treat you all funky-fied, and number two, you're gonna intimidate people. That's never good. So let's just sit here and be cool, and I'll just study, because I think I was getting my PhD or something crazy. So I'm gonna study. I have a bag. I'm called the bag lady because I always have a bag of books. So I got my bag of books. I'm gonna study, but I'm watching every fucking thing. This nurse is the same nurse that always has my papa, because he gets this shit every 3rd Thursday. So cool. She's putting the IV in his arm the way she should, but I noticed when she did it, there was what? Oozing at the IV site. So much so, she had to put additional pressure and what we call reinforce it with a bunch of damn dressing, hold it, okay? So I'm watching that shit, right? I said, oh my goodness, it's like kind of coming through a little bit. So she put another, okay, cool, I'm not saying nothing, I'm just watching this shit. So now, what do you think about what we wrote earlier? Chemo, radiation, cancer. What was the 3 letters? And. What did it mean? Before you can hang chemo, number 1, you know you have to be certified. Number 2, you have to put the PPE on. Number 3, you have to get another nurse to check it. But before you actually hang the chemo, you must check your patient for how severe is their aunt. Because depending on how severe it is, they may or may not get chemo that day. I think she forgot why she was doing the things we do. At least she forgot why we were doing the things we as providers order. She was going through the motions. She had drawn the blood at the time of the IV, which is exactly what we do. You send that off to the lab. You send the order down to pharmacy. They make up the chemo. Before you hang the chemo, you check that result you sent. No, she brought the nurse in. So I know when there's 2 nurses showing up, we're getting close to hanging the chemo. They're in full PPE, so we're really gonna be hanging the chemo. They're doing their ID check, so we're super close to hanging the chemo, and I don't fucking know what his labs are yet. So I decided to just pipe up and say something. How was Papa's labs today? Oh, I'm glad you said that. Hold on, I'll go get them. What did that tell me? No. So that is a nurse that's just going through motions. What does that mean? That means that you don't understand the rationale for the orders that you've received. You did do the CBC. You did. You did do it before the chemo, but you never checked the result before you hung the chemo. So when she walked in, she was horrified. She had this look, and she looked at my dad, my papa, because this is my father-in-law. She looked at my papa and she said, oh, no, you probably don't need to get chemo today. I said, what? Let me guess. Is it the platelet? She goes, yeah. I said, what, about 40, 45,000? She said, 44,000. How did you know that? I said, the oozing of the IV. It went on for a while. What did I teach you? Below 100, it's going to take you a minute to clot, right? Back to that again. And it took so long, and she had to come back and reinforce it. I'm like, shit, fuck, we less than 50. Now, what would have happened had she hung the very medicine to make this worse? He would be dead that day. No other day, that day. You feeling me yet? Because he already got a hole in his arm, so he's going to start bleeding out. You see? Again, you are going to kill someone if you don't understand what you are doing with these very seriously ill patients. Okay? So he's fine. We gave him steroids. It brought up his platelets with no problem, but he definitely did not get chemo for a good 3 weeks. He skipped that whole 3-week period. Then he's mad at me. You know I need my chemo. What you tell that lady? Listen here, Dad. Okay, so you just know you got to do what you got to do. Now, so in this bleeding precautions, I highlighted it because I need you sharp. When you start IVs, let that motherfucker clot off quickly or be alarmed. Okay? That's what I'm telling you right there. Okay? Now, you're going to teach, right? So we say teach call lifts. Call lifts is what you teach. And it means call lift this, call lift that, call lift this. You teach the call lifts. What are you telling this patient? Tarry stools, bleeding gums, bruising. What is the pinpoint red rash? Where will it be? Arms. Arms, they may not notice it on their chest, but it can be on the chest. But the arms for sure. Show you a bunch of petechiae. I have to show you an actual patient. I want to show you. Okay, so your petechiae looks like little red pinpoint dots. On brown skin is kind of like dark red, really dark red. Tea-colored urine, coffee ground emesis, nosebleeds. What is the nosebleeds fancy word on your test? Epistaxis, right? Epistaxis is nosebleed on your test. Epistaxis, let's just put that word there. Some of y'all was a little confused. Okay, since you looked all crazy and retarded, put that down. Then I added rigid abdomen. What's another way to say that? Rock hard, rigid, board-like. Now, what does it mean, all three? You are hemorrhaging inside. That's why on page 7 that says board-like abdomen, right? So you know all of these are going to be, page 7 taken over. So that's your problem. If your patient has that, that's not